So, in your opinion, what are the current challenges facing the healthcare industry in Asia?
Thank you first, the Daling, for this interview. I'm glad to be here this afternoon. But I think why, as a Belgian firm, we come over to Vietnam is, and more especially Southeast Asia, is because we think there are huge challenge for healthcare. And I think we arrive just at that perfect time because we have our expertise in our country, but we want to grow further and we want to share our knowledge. And I see that in this country, but also in the other countries around us, there are still a lot to improve. I visit many facilities, healthcare facilities, and okay, they are building new ones, but and there is huge difference between big cities and more rural zones. But I'm sure that with our knowledge and expertise, we can bring added value to not only the buildings, but the new working process, which are already implemented in Europe.
Very good. So, how do you think these challenges can be addressed in Asia?
What do you mean?
How do you think how do you think Asian countries can address these challenges? What can they do to address these issues?
I think a lot of things to do, because it's not only about buildings for us, well, for the staff and so on. It's also about education, staff and management. So first thing is, of course, education. If you have not enough doctors or educated, trained doctors, then you have already a problem. But once you have them, you need to put them in a good infrastructure. Otherwise, they leave the country and they go elsewhere, because it's much better over there. So if you can have both, a good education, and you give also good facilities, they will stay and they will do a really good job. But then comes the third part, and that's why you have here this conference. It's management. And management is maybe more important, because if you see, not only for Asia, it's also like this for Europe and United States, it's the management is the control of the cost to make it affordable. If it's not well managed, you will lose money each day. And even in US, you see hospitals going bankrupt because they are not well managed. Even they have a nice infrastructure and good educated people. So that means that it should be in the right balance between a good designed hospital, not too luxury, but a very well designed, efficient, flexible hospital, well educated staff with good trained staff, and of course a good management. And if one of those three elements are missing, then the hospital will fail and will, well, maybe lose money. And if you lose too much money, then you have to close your doors. And then it should be very pity for the area. Of course, there is a difference between social sector, the public sector, and the private sector. In the public sector, you can give some additional money. In the private sector, there's nobody else who will give you money. So you really have, in the private sector, to manage it very well. But the care must be still at a high level. It's not because you manage it well that you can, of course, decrease the services, but then you don't have satisfied patients.
Do you see any trends in the healthcare industry in Asia in the future?
There are, yes, of course, there are trends in each sector. But if there is one thing which will evaluate in the near future, especially in the hospital, is that there should be examples. There should be really the best examples of buildings, because those buildings are for the community. It's not a museum, it's not a hotel, it's not a nice office, and no, it's for the community. So in your life, you will, at a certain time, well, of course, you will be born in a hospital, but in several periods in your life, you will be confronted with a hospital. And at least you want to have a perfect service in a safe environment. And with a look to the nature or something like things, a healing environment, and not something where you're stressed. So it's very important to create nice environments. But also, design is one thing, the technology evolves. And the technology evolves very fast. And if you want to see, to be a little bit visionary, you have to look out what's upcoming. So you must be aware what's upcoming tomorrow, otherwise you will be blind. And then you will copy an outdated model from the past. So you need also do some pioneering work, some research, and create added value, so that you, when you make a design or something, that you create a building which is as flexible as possible for the future, and is adaptable, because the brief of today, tomorrow it will be different. And if you make a massive block, something like that, that's certainly not very, very flexible. So we have really to think together with the stakeholders to create very creative buildings and environment and so on.
So you think the trend it's that more and more hospitals are gonna try to create this comfortable environment for their facilities?
But then you arrive to another problem, is about the affordability, because if you make it nicer and with more medical equipment and so on, then there is of course a price. But there also, I think technology will help us, and more especially, and we heard already today in some sessions, is for example mobile health. Mobile health, everybody has his cell phone, and you will see this kind of technology will help us to improve the communication with the doctors, improve the communication between staff in the hospital, but also the communication with outside the hospital in their own network, and at least with at home, and the GPs, which are the general practices, which follow your health. And you will see also that with technology, your body will be full of, not full, but some sensor, which give some vital information to your doctor. Of course, when you're young, you don't need this, but for older patients, they don't need to go anymore to the hospital. They can send some information to it can be the hospital, to a certain place, and they can detect or not if there is a possible threat or not, and you just receive a message back, you're fine, you're healthy, just continue like this. So you don't have to take transportation, you don't need to go to the hospital, you don't have to wait, you don't need to need big waiting zones, don't need a lot of consultation zone. So that means that technology will transform also the buildings. The buildings will be reduced and get smaller and more human.
Yeah, it's true. You're not the first one who mentioned technology and IT technology development. It's a trend definitely coming in Asia.
But it will be difficult to implement it, because there are a lot of barriers, and it starts from the security, from the authorities. It starts from the industry, from the hospital. It depends how they want to work together, and as long as they work next to each other, it will be very difficult to implement.
Yeah, it's true. Well, have your objectives been met at Hospital Management Asia?
Yes, so far, yes. I think that the Ministry of Health, Madame Tien, she did very good speech this morning, because she emphasized for the hospital directors that you must be more than just a doctor. You must also know about finance, about construction, about HR, a lot of topics, and I really believe this is true. You must be an all-rounder and aware of all those situations, because managing in a hospital is big money. So if you focus too much only on some topics, then there are big risks for hospitals. Smaller hospitals, not so complicated, but especially if you grow and you have 500-bed hospitals or even more, this is really difficult to manage. So the function of a future hospital director is very high level. Yes, crucial, really crucial. But yes, it meet the expectation. I had followed some sessions, very interesting sessions. So definitely yes.
Good. What do you like about HMA, both the conference and the awards?
Can you repeat that question?
What do you like about the event?
The event.
Yes.
Oh, well, first, the first thing I must admit, I have the opportunity in the last 10 years to go on different congress, similar congress. Sometimes it's more about design and health. Now here it's a little bit more about management, of course, so it's slightly different, not so much for architects and engineers. But I think that architects and engineers should be much more involved because we are part of the solution. It's not only technology, it's not only HR, no, it's all combined. And as architect, we are used to work together with a lot of different stakeholders. So I was interested to see here the venue, and well, here in the Sheraton, and it was very well organized. So everything, so the brochures, the way they communicate, the way they make the meetings possible, the contacts with people, even the room, food and so on. It's really fine, very well organized. So congrats for that.
Thank you so much. Thank you very much for your time.